you can celebrate all year long. So as soon as we get those results up, so we have several that has already celebrated. We have several that are planning to celebrate, but we can see that there's several that hasn't or they're unsure. So now's your time. We are only on the 20th day of March. We still have several days to go in March, but we have all year for 2024. The celebration is not just a party. It's an opportunity to highlight what the senior nutrition program has to offer and to increase the connection to the older adults in your community. So let's keep this momentum going. If you're not sure or you haven't celebrated, find a time to really highlight the senior nutrition program and share that experience on social media. And remember to use the hashtag senior nutrition program. That allows your program to be part of a national conversation. So now I want to shift this celebration to our very special panel of guests who have improved how they serve older adults in their state, regions, and communities. And I'm pleased to be able to introduce someone from the Tennessee State Unit on Aging, an area agency on aging, and a local service provider to highlight their work across the state. So first we have Keita Cole, who is the Aging Program Director for the Nutrition Program at Tennessee Commission on Aging and Disability and the statewide dementia coordinator. In her current position, she oversees a nutrition program for the state of Tennessee, including both home delivered and congregate programs. Tennessee has over 200 nutrition sites across 95 counties and more than 10 years of experience in the Aging Network. She brings extensive knowledge of healthcare payers, home community-based programs and services, aging advocacy to her position. And she is a graduate of the University of Tennessee, Knoxville with a Bachelor's of Science in Business Administration. She completed her Certified Volunteer Administrator's credentials and is currently pursuing a master's degree in public health with a focus on community health and healthcare management certificate from the East Tennessee State University. I am also thrilled to have one of Tennessee's area agencies on aging. We have Holly Henniger Williams with us today, and she has been with the Upper Cumberland Development District for 23 years and has served as a director for the last 4. She graduated from Tennessee Technological University with a Bachelor's of Science in Human Ecology with a concentration in nutrition and dietetics. While in college, she volunteered for a Meals on Wheels program, and 3 years of this volunteer work further developed her passion to pursue a career taking care or caring for older adults. Along with Holly, we have Emily Sales. And Emily has been the Senior Center Coordinator at the Upper Cumberland Development District for 3 years. She served as a Senior Center Director for 11 years prior to working at the Area Agency on Aging. So she has a passion for helping older adults and works with 19 senior centers and nutrition sites in 14 county regions to help provide the best quality services. And last but not least, we also have someone from a local nutrition site on our panel today. Alicia Earhart became the director of the Fair Park Senior Center in Crossville, Tennessee in 2023, and before this had been the assistant director since 2019. Her mission is to always look for growth opportunity for the center. Their senior community is ever growing, and it has been her commitment to reach all of them, be a friend to them, listen to what the participants want and need, and most of all, continue to challenge them. So I want to thank each of you for joining us today. We're going to start by asking questions at the state level, and then we will ask the Area Agency on Aging and then move to the local service provider. So Keita, if you want to turn on your camera and unmute yourself, we will get going with your questions. So, Keita, can you provide some examples of policies or practices your state has implemented that have increased older adults' connections within the senior nutrition program?
Yes. Well, thank you first off for having me on the panel. It's very exciting to show what we're doing in Tennessee, and I'm proud of what we're doing and what we've done and how we're moving forward. But some examples of some policies and practices is we have started encouraging our nutrition providers to offer other activities around what we would consider typical meal times. So possibly breakfast, lunch times, different things like that, just to encourage participation, encourage those to be there, and then they would stay for a meal. We understand that sometimes the meals that they receive at our senior centers or nutrition sites, it may be the only guaranteed hot meal that they get that day. And so we want to make sure that they're engaged and they're focused and they're working um, to build those relationships, so they want to come back and they want to continue. Some of our sites have started providing snack carts or breakfast carts for some of those early participants that like to get there super early in the morning. Um, and we've seen an increase in participation with those carts. They do use donated funds and items from the community, so that helps build that connection within the community as well. And then also, we just share the innovative ideas that some of the other wonderful programs across the country are doing. We encourage our centers to partake in these, to adapt them to work for their region, and then to share on social media, to talk about it, to get the publicity going, to get their, we call them community celebrities, so their county mayors, their elected officials, and things like that, to come in and serve a meal and participate in there and have that feedback with those in the community that are coming in and enjoying those meals. It gives those elected officials an opportunity to see the impact that we're having in the community. And it also brings them kind of back into a humbling spot where it's like, you know what, these meals are not guaranteed. So we need to do what we can to continue this funding and get this going. So those are just some of the few examples that we've started. So yeah, that's one thing.
And that's wonderful. And yes, getting those elected officials, you can really get a lot of buy-in with your communities by involving them in those connections. And clear communication is essential for connecting on a state level. So, what strategies do you use to keep connected to your area agencies on aging within your state?
So we have a few things that we do. First off, we have, well, it's a weekly call that we do every Monday. So it's our entire state unit on aging. It's not just for the nutrition. But we have a call every Monday with the directors of our area agencies. And that it's usually I mean, we schedule it for an hour. Very rarely does it go an hour. Holly can attest to that. We may be on there 20 minutes at the most, but it's just a weekly check-in. Gives us a chance if there's something important, a new policy, a new procedure, something like that that we're doing, that we have that immediate access with them. So that's every Monday. I also do a bi-monthly nutrition call. So every other month we have a nutrition call, and it's the old school conference call. We don't do the webinars. We do as a conference call. So if somebody's traveling or if they're delivering meals or something like that, they can still participate. We open it up. I usually try to send out an agenda and make sure that we are covering everything that they want. Sometimes there's things on the agenda, sometimes there's not. I always try to give them some type of resource or activity that they can do just so it's worth their time to join on. But then we also open it up for them to communicate with each other. These calls are not mandatory. I don't do a roll call or anything like that. It's just an opportunity. If they're available, they can jump online. They can hear some things that are working, things that are not working in other areas, and then share those resources. The most recent thing that we've started doing, we're working with our director of volunteer engagement, who's also she's our senior center liaison. So in Tennessee, most of our nutrition sites are within our senior centers. So having that relationship with our director of volunteer engagement and the liaison has worked really well for us. But she has started a resource library for our senior center director. So it's online. They can access it at any time. We encourage them to share some of their things that have worked. So maybe it's a flyer, maybe it's an idea, maybe it's a form, something like that, there's no point in reinventing the wheel. So, if somebody's already using it and it's working, let's share it, let's adapt it, let's be able to use those resources. It also gives us an opportunity to kind of track what's being accessed the most. So then we can, if there's more education that needs to be around something, or if we need to have a special topic, conversation, webinar on our conference call, we can also reach out for those. So it's just, there's a lot of different things that we do to try to hit everybody, regardless if they're online or if they're, if it's a phone call, if they're out delivering meals or doing something else. So we try to do everything really together to meet everybody where they're at.
And that's wonderful. And I just know having those type of resources and sharing those out really does make a difference. And like you said, there's no sense in reinventing the wheel. If someone's already done it, let's share it with everyone else to make it easier.
Yeah.
So connection and networking between AAAs can often encourage creativity and improve services to older adults. So what have you done to foster connections between the AAAs in Tennessee?
So as I mentioned, we have those, bi-monthly calls. So that's a lot of where they have their connection and their communication. Again, the directors at our AAAs, they have the calls every Monday. Some of our nutrition providers get on those calls as well, especially if there's something specific that's coming out around nutrition policy change, adaptation, something like that. So those are the big things. I'm working to start a list serve for all of our nutrition providers. So it would be just somewhere where they can all be on the list serve and they can email out a question to the list serve and it would go to everybody. And then that way they're not all coming to me. They're not, if I'm busy or out of the office, they're not having to wait on me to respond, but then they can share resources across the list serve. And then again, with our senior center liaison, she has started a weekly resource guide that she emails out, and it includes grant opportunities. We do director spotlights for nutrition sites and the senior centers, senior center spotlights, events that they're doing. They share pictures. We encourage the communication that way. We also encourage them, to share their contact information so they can reach out, what we call offline, and still have that connection with each other, so they don't have to worry on or wait on the state to facilitate that connection. They can make those connections in their communities and pair up. And it's really good to see some of those connections happening, and some of those resource sharing has already started taking place, and we're super excited to see where it's going to go. This was a new thing for us. We got a new database, and so we're trying to come up in the world with our technology. So it's an exciting learning experience.
Nikita, that's wonderful. And thank you for that. And I'm sure that there's going to be plenty of questions for you. This really just shows how having an active line of communication from the State Unit on Aging to your area agencies on aging and then to your local service providers really encourages improved connection to participants within the senior nutrition program. Keita, hang on the line. You feel free to turn off your camera and mute yourself. We're going to move on to the area agency on aging, and we will bring them all back for questions when we get done. So Holly and Emily, if you want to, there we go. And so either or you can both answer, what type of initiatives have you used to enhance connections to services for older adults in your region?
Okay, I'll go ahead and start. I think we're going to tag team on the next couple of questions or so. So I'll go ahead and start talking about the new initiatives that we've developed over the last 2 to 3 years. Up until about 2002, we had a database that all of the area agencies across the state of Tennessee utilized. And within that database, we maintained a resource directory. It was just accessible by area agency staff. And so it was not something that anyone outside of our agency had access to unless they called us, and over the phone, we could determine what their needs were, and then we could look in our database to determine what resources we could share with them. All of that was handled in that manner. About 2 or 3 years ago, as a result of some COVID funding that came to our agency, we were able to expand how we share resources within our 14 county region. And we did that 3 different ways. One, we developed our own website, which is ucassist.org. And it's a very easy to navigate website that anyone can access. They can go in there, select keywords, and it will allow them to see within their particular county what resources are available based upon the information they entered in that they're looking for. So that was a key piece to the next step, which was utilizing some funding to purchase resource kiosks. And so there were about 40 or 50 kiosks that were purchased. What they were actually, it's tablets that are just put on a basic little stand that has our ucassist.org website on it. And so these kiosks were placed in a variety of locations throughout our 14 county region. They were put at senior centers. We have some that are actually getting ready to go into some local hospitals, other community agencies, libraries, etc. So just a variety of different locations that these kiosks were placed so that anyone within those communities has somewhere that they can easily go to pull up the UC Assist website and look for resources. Within that, within the UC Assist database, someone can actually fill out an information form. And if they're seeking resources within our agency, then they can complete just a basic little form and it will send it directly to our information and assistance staff, who will then follow up and connect them up with other resources they have. And then the third thing that we have done 2 years ago, we created a resource guide that's tangible, that you hold in your hands. And the reason we did that is because we wanted to diversify ways that individuals can access resources. So this is about a 90-page booklet that has a whole host of different categories of resources that you can imagine. They are categorized by county in our region. And so we are in the production phase right now of an updated version. Our goal is to update that every 2 years. As we know, resources are constantly changing. So we're going through that process right now of updating that and getting ready to produce a large volume of those to distribute over the next couple of years. So those are some of the things that we've done recently to get resource information into the hands of the people that need those, older adults, caregivers, etc. The final thing that I'll mention related to this is each year our agency puts on an annual caregiver and senior expo. And this is a regional event that we've been coordinating for over 20 years now. This past year in October, we held the event, and it was actually a record-breaking attendance that we had with over 1,000 attendees.
Wow.
As you know, the one thing that typically draws people to an event is food.
Always.
So we are very thankful that for many years we have had a wonderful partner with this expo, and they cook and serve food to all attendees at this event. All of our senior centers across the 14 county region bring their participants to the event, some by the bus loads. And it's a day of fun. It's a day of obviously great food, but it's also resource sharing. So we usually have around 100 vendors who set up booths to share the information they have related to caregiving and resources, other resources that older adults would be interested in.
Wow. I mean, that's amazing to be able to do all of those things. And I know resource directories sometimes are the hardest thing to keep updated, but just having those kiosks and ways that people can find the services that they need, as well as even coming to your centers and finding them, but they have other ways to really get in touch with those services.
Right. Yeah.
So the next question is, when providers can connect, we find that they will share resources and ideas to improve services for the participants. And what have you done to foster connections between your local service providers in your region?
So I think the biggest thing that we've done is that we offer quarterly senior center directors meetings. These senior centers, like what was said earlier, are usually congregate nutrition sites also, and giving them an opportunity to meet together gives them a chance to share their successes and challenges. And through listening to their challenges, it gives us an insight on how we can best support that provider network. The Senior Center webinar series and resource library that Keita spoke about earlier has been a great asset. It gives the directors a chance to hear from other directors across the states about their successes and struggles, and opens up that communication. Much like the benefits of attending the senior center, the directors are in an atmosphere with people who have similar struggles. and they're able to relate in a way that not many people can. This not only builds relationships, but also reaps great benefits for the senior centers in the long run.
And I'd like to add to that. I'm going to brag on Emily because, as you mentioned when you were reading her bio, Emily came to our agency with 11 years experience as a senior center director. And a few years prior to coming to our agency, she actually started a congregate and home delivered meal program in our region. And that experience, that relative experience that she has had, has been such an asset, not only to our agency, but to all of our senior centers in our region. She understands what it's like to be a senior center, so she can talk that lingo with them. Mm-hmm. And as a result of her nutrition experience, she has worked hand in hand with so many of the centers, and Alicia's one of them, to encourage them and support them in becoming a nutrition provider for our agency. We used to have one nutrition provider that covered all 14 counties. And I guess it was about 6 years ago now, that provider had to back out. And so it's been a process, but as a result of Emily's efforts, we have had a tremendous period of growth and successes within our nutrition program because she has walked down that path with them. And now also, as we have other centers that are thinking about starting up their own nutrition program, be it congregate, be it home delivered, she pairs them up with other senior centers that they can shadow. And so it's really worked beautifully in our region.
And that's wonderful to hear. Just we always go back to the boots on the ground. And whenever you have those people that come from that background and that can help speak, like you said, speak the language at every level, it's a completely different language that is spoken. So being able to speak the language and really relate to them is one of the key points for success. Mm-hmm. And with your region, I mean, each community has areas that can be difficult to serve. How has your agency connected with the difficult to serve areas within your region?
I'll go ahead, Emily, and share about the Every Door Direct Mail that we have utilized in a variety of our programs here at the area agency. But I don't know how many people are familiar with the Postal Service's Every Door Direct Mail program. This allows you to select certain zip codes and certain populations within those zip codes to do direct mailings to. And so we have done that to promote our senior centers, to promote our nutrition programs, like I said, many other programs here that we administer. But that has really proven to be very beneficial for us over the years and allows us to target those. Even though all of our counties are rural, there are pockets where are even more rural. And so it really does help us target those individuals, the low income population, et cetera. So that has been very helpful to us. Another thing that we have done is we've been, I guess, for about 12 years, 13 years now, we've been partnering with our senior centers and it's called the Human Resource Agency. It's our sister organization here that runs our public transportation program. So we utilize an Older Americans Act funds. We provide transportation vouchers that the senior center directors distribute to individuals in their community who are over the age of 60 and trying to identify those who are low income. Allowing them to have these transportation vouchers so that they can ride the public transportation system at no cost. So they can use the vouchers to go to the senior centers, obviously the nutrition sites that are co-located there, to go to doctor's appointments, to go to the grocery store, basically anywhere they might need to go, they can use these tickets. So that really has helped us as well.
We also contract with local senior centers to deliver meals to some of the most rural areas in our region. Senior center, and then also senior centers as well as the area agency utilize Facebook to reach out to seniors who tend to stay home. It encourages the seniors to get out once they see the fun things that is going on at each center. And it kind of gives them an incentive to get out of the house and join what everybody else is doing.
Absolutely. Wow, thank you all. And like I said, you will have questions, I am sure. So I want to thank you for being on today. Please stay on the line. You can turn off your cameras and mute yourself. And we're going to switch gears to our local service provider. So Alicia, if you want to turn your camera on and unmute yourself. Older adults can often come into a nutrition site, and whether it be a senior center or other nutrition site, it can be overwhelming. And sometimes it's difficult to make that first move to talk to someone new. Can you give examples of how you connect new participants to maybe other participants at your sites?
Yes, of course. So you're absolutely correct. It is overwhelming for most people that come in here, especially if you're in a larger senior center where there is a lot of activity going on. That many people can be overwhelming. So we have a group of people that we call our sunshiners. Of course, we don't refer to them as those people to new participants, but they catch on because they're just unique people. They're the ones that thrive in large groups, always want to expand their little circle, just always welcoming. So the first thing we really do is get them familiar with our facility. So they come in and we give them a tour of our facility, each room, what goes on in each room, all the activities that we have. And then most of the time, our sunshiners are always participating in one of our activities that's going on that day when new participants come in. And I immediately just go and introduce them to a new friend or friends in that group. And they just catch on very quickly. They feel comfortable. And I've noticed with this that when they connect with people in particular, they tend to come back, especially if they're familiar with the facility and have a friend. They usually always come back.
And that's wonderful. I mean, even myself, if I get into a large group, it becomes overwhelming. So just having that nice, friendly person that says, "Hey, come with me. I have you." You know, that really does set the stage for those new participants to have some more success as they continue to participate. So when older adults participate in the senior nutrition program, they may also benefit from other services offered through the Older Americans Act or even within the community. Is there anything that you've done creatively to connect older adults to other services within the Older Americans Act or even within your community, county, or region?
Yes, I'm glad you asked. Actually, this year we started because there was so many people that would come in because we serve as a resource information center. That's what senior centers are here for. And so everybody that comes in is looking for something, some kind of information. So we started an information station, which is a huge wall in our lobby that has all of our information on it, whether it be our senior center meal calendars, our monthly calendars, anything special that's going on in our senior center. But also on this wall, we have the community connection section. And so that just keeps them connected with the community. It might be some events that other senior centers are holding or evidence-based programs that other senior centers are holding. Because I have noticed while I've been here that seniors really want to connect with not just their community, but other communities surrounding. And there's so many services that are provided to them or that are available to them. So on that community section, we have Area Agency on Aging on there, the National Council on Aging, our nutrition education forums. I mean, all kinds of stuff that we really continue to stay up to date with. UCHRA, any services like that that are available to them, we keep on that wall. And we always, when we show them around our facility, that is one place that we show them so that they can go and get their new forms or the new calendars, any information that they need.
And you also connect with the home delivered meal clients as well. So is that
Yes.
correct?
Yes, we work with the Area Agency on Aging to kind of stay connected with them. A cool little project that we did this past year, we did an angel tree and it was just our home delivered clients. So we partnered with the Area Agency on Aging and got names and addresses from them to be able to deliver each one of our home delivered meal clients. Christmas presents, a bag full of Christmas presents. So we try to stay up to date with them and gave them a brochure of everything that we have going on and keeping them connected with the community as well.
Thank you for that. And many participants have noted that the connections they make within the senior nutrition program has improved their overall health. Can you share an experience within your site, how you've seen this firsthand?
Yes, there's a lot of testimonies and success stories that I could share, but one that really sticks out to me. We have a woman here that I met because of the senior nutrition program. She began in the senior nutrition program, and she was a congregate meal. So she would come in and eat, but she would always find her way to my office. And I caught on really quickly that she just did not handle groups very well, to the point actually that she was very unapproachable. So she didn't have to deal with making new friends, things like that. And we see that a lot because of the isolation. But that, again, that's what we're here for. She has become one of my favorite members, but one of my favorite success stories because this wall that she had, I mean, it was so binding on her. And you could tell that it was just, she wanted to make friends, but she just didn't know how. She couldn't process it emotionally. So one day, out of the many days that she was in my office, she said, I really like bingo. And I said, well, they're playing bingo today. Let's go in there. She's like, oh no, there's way too many people, because we usually average around 90 people, 70 to 90 people in bingo. They love their bingo. So it can be overwhelming. So I was like, you know what? I have some time. Let's just go into bingo. And she's like, you'll stay with me? I was like, yes, we'll go. So we got in there, and of course, I picked out the Sunshiners group. But Sunshiners didn't work for her because she was like, they are way too happy for me. But that's really the wall that she had. So I deliberately chose that table so that she could get acquainted with them and see how friendly and how easy it was to be friends with them and connect with them. So one thing led to another, and she became friends and started to come to all of our meals. And not only that, but she started traveling with us, doing our trips with us, which opened her up so much, because when you're trapped on a bus of 11, 12 people, you have to communicate. So she really just flourished. So much that she comes into all of our exercise classes now. I have learned that she loves music. So if we put on some good music for her and have her dance into it, she will. We have a new class called Drums Alive, and she is the best person in there. But she has changed so much that not only does she come to our meals, but participates in different activities all throughout the week. When I say 360-degree turnaround, she was in the newspaper for our Drums Alive, and she was the first one up there doing her Drums Alive. And she just is such a happier person. But it took that moment to break out and be who she really is on the inside. She just didn't want to show it because she didn't know how to process it. And I thank the senior nutrition program for doing that, because if it wasn't for that, we may have not seen her. She may not have ever came here and participated and broke out of that shell that she had in that wall that she had built against people. So I'm proud of her, but I love seeing her in here, and she invites people to come. She tells them all about our program. So she's really came out. But there's other success stories just like that, but she's one that really is near and dear to me.
And look at that, she's now a sunshiner.
Yeah,
So,
yes,
and just look at
exactly.
that. Yeah, how wonderful. Thank you, Alicia. And it's been amazing to hear all the wonderful things you're doing. And I'm going to ask each of you just a real quick question, and you can just provide a quick answer. And if all of you want to turn your cameras on and be ready. So, Kita, what does connection in every bite mean to you on a state level?
Connection in every bite, for me, it's both physical and mental. Our consumers, they want to connect physically when they come in to eat. So they have that connection with the food that they're touching, the food, the volunteer, the person that they're interacting with. But then also understanding that it's a mental connection as well too. Like I said, sometimes our meals are the only guaranteed hot meal that they have. And so that mental connection to break down that isolation, just like Alicia was talking about, they're just needing to find a reason to interact with somebody. And now you have this lady that had these walls built up, and now she's a sunshiner and she invites people. So it's just being able to connect. So we want to take any doubt and worry away that they have, that it's a scary environment, I'm not going to get a meal. And we want to break down those barriers and break down those walls.
And Holly and Emily, one of you can answer, what does connection everybody mean on the AAA level?
Okay, I'll go ahead if that's okay, Emily. I think at the AAA level, for us, it's really important that we find providers that are not in this just to provide the meal. They're in this to holistically meet the needs of the populations that we serve. And I think what Alicia just shared with us, that success story, says it all. What she is doing at her center is exactly what we want each of our providers to be focused on. And it's meeting the mental, the physical, all aspects of the needs that the population has. And we have a fantastic provider network, and having that solid network is very critical to the success of the programs.
And you're so right. Alicia, and it's your turn to answer. What does connection in every bite mean to you?
So, all of our lives we're challenged to learn something new, stay active, be good citizens, help people succeed, and the list goes on. And I've noticed that as we age, we tend to become out of sight, where we are no longer challenged by outer influences, but instead, our senior community is finding it hard to live the lives they once cherished. So, connection in every bite to me is bringing people back together and connecting them back to a time they once cherished. Gathering around the table for supper is something that we all cherish with our families. And as we age, our families grow. And not saying that they're all neglected or anything like that, but those are times that they cherished. And so bringing them together to around the table to converse about life and laugh together. I mean, it's a time to bring them back to the time that they once cherished.
Absolutely. And thank you all so much. And thank you for all the work that you're doing together as a state to really make that connection for your participants. I want to open the floor for audience for panel questions. If you could put your questions with who you want the questions to go to in the Q&A section, Kathy Wilson Gold will read them off for us. And if the panelists could turn your cameras on and be ready to unmute yourself once you receive a question.
Great. Thank you, Catherine. We do have some questions, and I'm going to jump right in. The first question is for Alicia. Do you serve breakfast and lunch daily? And is the cart provided by the center or by outside vendors?
I think the cart was something that Kieta had said, but as far as our senior center, we serve 4 days a week. We do Tuesday breakfast, Wednesday lunch, Thursday breakfast, and Friday lunch.
Anything you want to add there?
Yeah, I'm sorry, Alicia. I was just going to say that our nutrition sites, they decide if they want to do breakfast and lunch. Some do both. Some just do, like Alicia said, one or the other. And then the carts that some have implemented, the center keeps the carts up, but they can utilize some of the funding that they can, to get the more nutritious snacks. But then we also have donated food or donated funds to the centers that they can then purchase some of the outside. We want to have a wide variety. So we have some fruits, but we also might have some crackers, and we might have some, little donuts or something like that. So we want to try to hit everybody, but we want to stay within the rules of the Older Americans Act. So yes, it's kind of a combination, and it's really flexible on the area for each agency. They have the ability to kind of choose what works for their area.
Okay, great. Thank you. Another question, Holly, Emily, Are the resource kiosks, actually anyone probably can answer this, are the resource kiosks provided through a vendor that contracted to maintain the kiosk and provide technical support, or does the AAA have to maintain it themselves?
Yes, the AAA maintains the database internally here.
I do want to mention that we do have a question that's in regards to the final rule that took effect on March 15th. I just want to quickly say that fact sheets and social media materials can be found on our website, along with recordings from previous webinars and registration links. ACL will provide a robust technical assistance and other resources to support states, tribes, and tribal organization, area agencies on aging, and others in the aging network in meeting the requirements of these new regulations. We'll also partner with grantees in a supportive corrective action process if more time is needed to fully comply with specific provisions. Well, I want to assure you, and we want to assure you, that any questions that have been placed in the Q&A regarding the final rule we appreciate, and we will use those questions to help guide future resources and assistance. Just another question, Catherine, if we do have time. Kita, you mentioned you had received positive feedback from AAAs. Can you give us some examples of what the AAAs and maybe even the senior center directors are saying about the increased connection available to them for resources and for training?
Yes. So we've had a couple of the, with our senior center liaison that does our weekly resource that she emails out, we've been doing some center spotlights and director spotlights. So that's really been encouraging for not only to spotlight like Alicia, which Alicia, you need to get in a submission, we need to spotlight you, but to spotlight what they're doing and how Alicia worked with that one individual to, change the way she was thinking. They have communicated to us that it's really great to have the resources. A lot of them have forms or contracts or flyers or things that they're wanting to put out, but they don't know where to start, don't have the time, don't have the resources. So when we have those that have already created those and we're sharing them, they're just very thankful to have it. They're providing a lot of feedback on what they're looking for. So then the senior center liaison and myself are working together to get those resources, whether it be from ACL, National Nutrition resources, different things like that, so we can provide all of those resources. So they're just very thankful to have that connection and know that anytime they need anything, they can reach out to us at the state unit, to the AAA, or even each other, to have those connections and be able to work together.
Thank you for that. And thank you, Kathy Wilson-Gold, for helping me with the Q&A. That's all the time for this line of questions. So what a great discussion from the panel. I'm so excited to hear all of this information, and our panel guests will stay on the line and be available for more questions at the end. So feel free to, if you think of another question, put it in the Q&A and we will address it at the end. I'm going to quickly utilize the chat. We're not going to talk about it too much, but just for timing. But if you have celebrated the senior nutrition program, utilize the chat and tell us how you've done it. And what we plan to do is take those, take what you enter in, and you may see your suggestion on our celebration webpage next year for the 2025 celebration. So you, Catherine Shavo is going to be handling the chat as we move forward. And I'll just thank you ahead for all the amazing ideas I hope you put in there. So I hope everyone who has joined us today has been inspired to celebrate the senior nutrition program and will emphasize connection in every bite with the communities you serve. Our next speaker is Carrie Liparini, who is our Director of the Office of Nutrition and Health Promotion Programs, or ONHPP for short. She will be providing our call to action to help guide you on ways to enhance your celebration throughout 2024. Carrie?
Thank you, Catherine, for the introduction. And so actually, since we're speaking about connection, I want to make sure that I have a good connection, because I've been having some really horrible connection issues today. So I do hope to be able to stay on through this entire part of the webinar. And I'm thinking, since we're coming off of, St. Patrick's Day, perhaps I could channel some of the luck of the Irish. So I'm going to ask for you to help me keep connection in every bite. So please add some shamrocks and rainbows and pot of gold into the chat box to send me some luck so that I can continue this part of the webinar. Thank you. So I want to start really by thanking our panelists who illustrated our connection in every bite theme so wonderfully. Their ability to communicate and work together to improve connection in their participants is outstanding. Everyone in the Aging Network can make connections that enhance ways we serve older adults. And as our panelists indicated, it starts way before the participant comes into a congregate meal site, or contacts for home delivered meals. As panel members highlighted, making connections starts with policies. It starts with planning, forecasting the needs on the federal, state, regional, and local community level. So planning your policies and procedures to include input from the state, from the regions, from communities you serve, and then ensuring the flexibility, because that limits barriers for participants to get the greatest efficiency. Once your policies and plans and services are developed to meet unique needs of those you serve, then you can begin to connect to others in your community to expand your reach and be effective. The success of our senior nutrition program is achieved by more than just one provider or agency. Our strength comes from a web of connections between everyone in our aging network. Bolstering our network's connection and learning from one another only increases the positive outcomes for older adults. And we know how, again, important connection is for the people we serve. Meaningful connections, especially as we age, are vital to our overall health and well-being. A good way to make connections is by coming together, as mentioned, around a meal. And studies, again, have shown that people who dine together with others regularly eat healthier and report a better quality of life. It provides a sense of structure and belonging while offering a great opportunity for improved nutrition. Sharing a meal can also provide meaningful ways to connect with others over shared beliefs and cultural interests. These benefits can impact physically, mentally, and social health. Again, improving nutrition, reducing risks of chronic conditions, improving mobility, increasing self-care, reducing anxiety and depression, and reducing loneliness. So as we celebrate connection today, I want to leave you with three things, three ideas for generating and strengthening yours. First, actively listen. Listen to your participants and to others in your network and community. How do we do that? Consider conducting surveys regularly, communicating services available often, and involving older adults in the planning of programming. This can also improve quality, participation, and overall outcomes. Listening to the needs of your state, your AAAs, your local community will allow you to identify improvements that can have the most positive impact. Number two, form and strengthen partnerships. This can be done by increasing and strengthening your collaboration efforts, can expand your reach, and services that can improve sustainability. And finally, share with us and others in the Aging Network the successful strategies that you use to continue connections to participants. As we share these promising practices, it helps us to strengthen services, innovation, and ultimately improve supports for older adults across the nation. Connection in every bite is all about togetherness. By connecting across the network, our reach and capabilities expand. Our service connecting older adults not only to nutrition, but to socialization and health promotion programs, but also a range of other home and community-based services that support community living, independence, and aging in place. So finally, I just want to say thank you Thank you all for the enormous difference that you are making in your communities and the lives of older adults. And so now I'll turn it back to Catherine, who I think has additional Q&A for us.
Yes, I do. And because we are really short on time, I want to say first, go ahead and put your question in the Q&A if you have anything else, but I want to remind you of celebration materials that you can find on acl.gov/SMP/celebrate. And make sure you go visit because there's a lot of information in there that can help you. So we got a couple of minutes for questions. Kathy, do we have any other questions?
I do have a question. How is using the hashtag senior nutrition program going to help our program?
Hashtags are very valuable if used strategically. So using them in a social media can actually boost your reach and engagement. And we at ACL have chosen one hashtag to better connect the senior nutrition program, because if we have too many, then they get lost. So if we have one hashtag, then everybody can use it and we can see everybody in one place. So use that hashtag senior nutrition program, and that will make you part of that national conversation. So I'm going to, is that the last question? Do you have anything else?
We do have one quick
Okay.
question, and I think you answered it earlier, but when is the recording going to be available? Do you want to restate?
Yes, it should be up on that celebration webpage within a week. I would that it's usually there within a week. I usually say 2 weeks, but they always beat me to that. So it's usually, we should have it in there within a week.
Okay. That's it.
Okay, so don't forget, there is going to be a post-event survey in your chat. If you want to go to that, filling out that will actually help us for future events. It just helps us, streamline things better with our webinars. And we want to thank you all for attending today to help us celebrate the senior nutrition program. And just thank you for all the amazing questions, all the amazing work that you do. Now go share your story on how your senior nutrition program provides a connection in every bite. And don't forget to post your celebration on social media and use the hashtag senior nutrition program. And I will also email out that post-event survey to all attendees as well. If you have any questions, feel free to reach out to me at catherine.tucker@acl.hhs.gov. Thank you and enjoy the rest of your day.